how it works, what are the benefits, what's the most common use cases that you see people using it for? Because you mentioned that you sold 30, 40,000 units so far. Did I get the number right?
That's right. That's right. I think we're somewhere in the mid 30s right now. I'll have to confirm with the team, but yes, it's before the end of the year. It'll be 40,000 devices that we've shipped within 2 or 2.5 years of starting this. But we'd see essentially to kind of give the use cases, and we to kind of address this as well from a skepticism standpoint. Because I was also skeptical with this when I came in. You see a number of claims around photobiomodulation. And it does raise the question of how can you treat all of these different things? And I think one of the things that we try to address with this is essentially what we're treating is oxidative stress and inflammation. And when you can treat those two things, you see a powerful impact for so many different pathologies. And it seems like, oh, well, we can treat your lower back pain, but we can also treat plantar fasciitis. How is that possible? But essentially, it's treating the same mechanisms that are causing the problem. So in both of those cases, they're often repetitive stress, so lower back injuries and sciatica. It seems different part of the body, wildly different pathology than it would be for something like plantar fasciitis or patellar tendonitis or Achilles tendonitis. But what you're seeing is really the soft tissue responding to overuse and repetitive stress. And because of that, we treat a number of things very well from a pain and inflammation reduction standpoint. And that's things as disparate as pickleball players and tennis players with tennis and golf elbow. We treat that extremely effectively. But on the other hand, we're also working with marathoners and ultra marathoners and triathletes for things like issues with their soft tissue in their Achilles and in their feet, because that's where they're presenting this overuse and repetitive stress injuries. And then even through to where we work with the Olympic weightlifting teams. It's like with anything weightlifting from an Olympic standpoint, it's kind of the same movements. It's knees, it's lower back, it's shoulders, and it's kind of elbows and wrists. And so you do those repetitive motions over and over, and it just puts too much stress on the soft tissue, and you need to be able to recover it faster and reduce the inflammation. And that's really what we do, is reducing the inflammation and reducing the oxidative stress that can be caused by overuse of joints, soft tissue, and muscles.
And you combine different lasers and light all together. Is that the trick behind it?
That is. We've what we've found is that when we dug into the medical literature, there were what we consider engineering metrics that were used for dosing. And in light therapy, very much like in pharmaceuticals, dosing is key. The body responds on what they call a biphasic dose curve, which is if you increase the dose, it increases the outcome or the kind of results that you would like until it hits a peak. And then after that peak, it goes back down. So as an example with pharmaceuticals, you take 2 aspirin, you have a good outcome. If you take 10, you're not going to have a good outcome. And it's very similar with light.
Probably not, right?
That's right. But what we've seen is in the market from a light standpoint is things like LEDs are harder to dose effectively, and especially internally for kind of internal inflammation in the tissue. It's the comparison that we make with kind of the panel products that are in the market for this is it's almost like taking the aspirin bottle, and instead of selecting your 2 pills out and then taking them in a targeted and effective dose, you're just shaking the bottle in front of your face and hoping that the right dose falls in your mouth.
Well, that's exactly where I'm headed with, my interest is because these panels are everywhere now.
Yes, we don't like to beat up other people's products. It is in one way a good thing to have out there. We consider the panels a generation 1 product for light therapy. It exposes the concept to people, and there are a number of things you can treat effectively with these. It's just harder to dose it. Superficial level skin treatment for wound healing, increased fibroblasts, reduced wrinkles. There's a number of things you can treat within the superficial tissue. It's just very hard to dose with these because the LEDs emit in a 120 degree angle and they overlap. And so if you're, 2 inches closer or 2 inches further away, the dose that you get out of that is massively different. And it's just extremely, extremely unlikely that you're going to have an optimal dose because of that. And so what we've done instead is instead of saying like, hey, here's how much light we expect to be hitting your skin, what we've done is we've used mathematical models that we've spent tens of thousands of hours developing now to show how photons distribute through tissue. And we know at what depth of tissue the photoacceptors exist that we interact with these different wavelengths of light. And we know how much we can use from the light to trigger those. And so we build these models mathematically, these Monte Carlo models that show how the photons distribute through the tissue. And then we test these with triggers that we know are in the physiology. And so an example of one of those is our 808 nanometer lasers trigger the release of nitric oxide from hemoglobin. So hemoglobin in your blood is a carrier molecule. What we think about it as is a carrier of oxygen, because we think up until very recently, from a medical standpoint, we've thought about the kind of gas exchange in the body as a two gas kind of system, carbon dioxide and oxygen. But those binding sites on hemoglobin are competitive for oxygen and nitric oxide. And so when you can remove the nitric oxide, it gives another binding site for oxygen. And when those nitric oxide molecules go into the blood, they're dilating factors for the blood vessels. So it allows better blood delivery into the area by releasing these nitric oxide molecules into the area, and allowing them to open up those blood vessels allows more oxygenated hemoglobin to come into the area. But it also gives us a measurement point where we can say, we expected this much nitric oxide to be released, and here's what we've gotten. Here's what we've actually seen in the physiology. Why do we see this gap? And go back and optimize our dosing modules or dosing modulation based on that.
And how precise do I have to be? Because you were describing the difference between the panels and having the right dose, and basically, how do I know where exactly to position it for it to make an effect?
So there's different for different parts of the body. As an example, for the knee, what we found, we do follow-up calls with many of our users who don't see the results, and because our mission is to help them with their quality of life and to reduce their pain and inflammation. It's not to sell them a product. My partner and I have put our calendars out for anyone who has the product and who's not getting the results they expect. Please book a call in with us so we can help you with this. And one of the things that we found with this is that
seems like I have an extended version of that now.
Yes, anytime. You're welcome anytime. What we found with this, one of the things that we found with knees, as an example, is if someone has their knee flat at kind of 180-degree angle, just completely open, they almost never get the benefits that they're looking for from that pain and inflammation reduction. And the reason for that is, and so we advise you doing it at a 90-degree angle. When you do it at a 90-degree angle, you have two channels to the side and below your patella that open into your synovial fluid. And your synovial fluid is where really you see most of the inflammation that we're actually trying to reduce. And so when we can target those through these channels, it makes a huge difference in the outcomes relative to the inflammation changes and relative to that soft tissue repair over time. And so that's an example where the positioning is very important. There are other examples for shoulder, which are almost on a personal basis. So we see people experimenting with the shoulder placements and finding what works for them relative to the soft tissue that's damaged. So there's a number of ways of treating that are different. My personal treatments on a daily basis, we've also been experimenting with a number of things for blood treatment. So again, when you're seeing this nitric oxide is a really powerful vasodilator, but also just a powerful kind of signaling molecule in the body. And there's been a Japanese group that have been studying what they call the proximal priority therapy, which is, so you can see how I have mine set up, essentially using these on the large blood vessels in your neck and treating your blood by way of doing this. And what we're seeing for this is what's referred to in the medical literature as remote photobiomodulation, because essentially you're treating blood that's moving throughout the body. And what we see from this is systemic inflammation reductions, and then some also very powerful changes in things like fertility. So female fertility has been one where that same Japanese group that was testing this, they did a 229 individual study, and on specifically on women who had been deemed infertile and had not had a child, been trying for at least 5 years and had not had a child. And within 9 months, 28% of the cohort had gotten pregnant, and 22% of those came to full term healthy. And so when you're treating different parts of the body remotely by treating blood or treating, for example, the gut. We've seen some really powerful treatments for the gut that actually impact brain, liver enzymes, a number of different things in the body, autoimmune health. Just the yeah. So long story short, there's different points where, again, if you're treating local tissue for the knee, you want to have it specific on this. If you're treating kind of general health or brain health, gut health, you can actually treat some of these remotely. So there's different kind of mechanisms that help mediate these outcomes, but the outcomes are very clear, and it's really interesting to see because it's not always just treating the local tissue.
What is your take on like basically fixing these issues versus looking at it more from the recovery standpoint and pain prevention? Right? If I don't have any issue right now, should I still be using your device so I don't get into any troubles later?
I think so. I treat two different ways daily. This proximal priority therapy treatment on the neck, and then a treatment on my gut. And these are essentially preventative. And since I've been doing those as a combination over the past 3 months, I haven't been sick once. And so what we're seeing is, again, a lot of this is translating back through to immune health and then autoimmune health. And one of the reasons we started testing these protocols on kind of, I think of it as myself as an N of N equals one, because I'd love to get into the literature and start kind of pulling it in and testing on myself. But the reason we started looking into that is the gut treatments. Your gut is a massive high leverage point of health for your body. So if you have an inflamed gut, or if you have gut dysbiosis or leaky gut, the inflammation doesn't stay local, and you see this presenting in a number of different ways throughout the body. When you can treat it, we've seen impacts in autoimmune disorders as vastly different as things like asthma and multiple sclerosis. And that's only been over the last couple of years that people have been testing into this. And the mediating factors for these, there's so many variables around the gut and how it presents these changes, or what mediates these changes, that we're still looking for the mechanisms as to what's happening there. But what's very clear is autoimmune disorders are positively impacted by treating your gut with laser therapy. And so from a preventative standpoint, there's really some powerful things you can do to reduce inflammation, to keep the tight junctions in your gut tight, not having them leak and kind of drain inflammation into the rest of your body. And your body really responds well to this from an autoimmune standpoint. So kind of better recovery numbers from an HRV standpoint, and then really big impacts on things like asthma, multiple sclerosis, and again, just immune function as well. Lower numbers of sickness, and then faster recovery when you do have inflammation related sickness.